Welcome to Hacking Your ADHD. I'm your host, William Kerb, and I have ADHD. On this podcast, I dig into the tools, tactics, and best practices to help you work with your ADHD brain. Hey team, in this episode, I'm thrilled to welcome Natalia Aíza, a multilingual counselor and OCD specialist. Natalia is the founder and executive director of Kairos Wellness, a therapy center that focuses on holistic care for clients experiencing OCD and anxiety, located in Boulder, Colorado. They offer therapies including exposure response therapy, ERP, cognitive behavioral therapy, CBT, play therapy, art therapy, acceptance and commitment therapy, ACT, eye movement desensitization and response, and reprocessing, EMDR, and neurofeedback. Obviously, we won't get into all of that in our conversation today, but we do hit on a few of those. Also separately, I wanted to mention that Kairos is the Greek word meaning the perfect, delicate, crucial moment, the fleeting rightness of time and place that creates the opportune atmosphere for action, words, or movement. Also weather. And I really just wanted to share that because I love words like that and I just find them neat. So anyway, in our conversation today, we dive into the overlap of ADHD and OCD, how they are similar and how they differ, and also the unique challenges each presents, especially when they are co-occurring. Natalia shares her experience and professional insights on distinguishing between ADHD distractions and OCD compulsions, and how we need to approach treatment for them each in different ways. If you'd like to follow along on the show notes page, you can find that at hackingyouradhd.com/209. Need a nudge to navigate your ADHD? I know I did. Well, check out Shimmer, our sponsor for today's episode. You may remember when I recently chatted with Shimmer's co-founder Chris Wang in episode 207, in which we discussed the power of community, process-oriented goal setting, and what it means to live in alignment with your values. Shimmer connects you with expert ADHD coaches who understand the ins and outs of managing ADHD at any age. So, if you're ready to jumpstart your ADHD journey, head over to www.shimmer.care and use the offer code HackingYourADHD, all one word, to get a 30% off discount on your first month. That site again is www.shimmer.care, code HackingYourADHD. Also, before we get started, I wanted to let you know about my AMA on YouTube Live, happening the week this episode is released on January 31st at 10 a.m. Pacific. If you're interested, you can find that on Hacking Your ADHD's YouTube page, youtube.com/@HackingYourADHD, and subscribe to the channel. Or if you want to submit a question ahead of time, you can do so at hackingYourADHD.com/AMA. I'm really looking forward to getting to chat with you all, and I hope you can make it. January 31st, 10 a.m. Pacific on youtube.com/@HackingYourADHD. And you can find all those details and ask questions early at hackingYourADHD.com/AMA. All right, keep on listening to find out how OCD can fit into the ADHD picture. All right, one of the places that'd be great for us to start is getting some definitions of what OCD is, obsessive compulsive disorder, and we also were going to talk about the generalized anxiety disorder. And I figured if we start off with some definitions there, that can help get people into what we're actually talking about.
Absolutely. So thank you so much for having me on. I am beyond excited to talk about OCD on an ADHD podcast because the concurrence is actually quite high. ADHD is the number one most co-occurring mental health diagnosis with OCD. So just to introduce real quick, OCD is not I'm so OCD or a personality. As many of us have clarified in the public eye, OCD is quite misunderstood as people being very anal, very precise, very clean. Those are all very outdated misconceptions. OCD, what it actually is a cycle. So OCD starts with either an intrusive thought or an obsession. So I will have an intrusive thought, I just hurt someone back there with my car. Right? So I'll have that intrusive thought. It comes into my head unbidden. And my OCD will make me want to soothe that obsession with a compulsion, which basically means I will do something about that obsessive thought. So when a person without OCD gets an intrusive thought, something funky like that, they're able to sort of keep going and know that it's just brain noise. With OCD, we get really fixated on our brain noise. We attach meaning to it. And we feel the need to do something mental or physical to soothe that fear. So we get short-term relief because we turn the car around and checked and, oh yeah, no, that was just a speed bump, not a person. and then we keep driving. But what happens is we have just reinforced that cycle. We have just reinforced a neural pathway that indicates to our brains that we potentially could do that dangerous thing that our OCD tries to make us think we do. So OCD can be about danger. It can be about perfection. It can be centered around contamination. There's many different ways that OCD can present it. It can even focus on a relationship and have you be compulsive around the person that you love. But regardless of where OCD centers, it is a cycle. It's a cycle of self-soothing that actually reinforces the core fear.
This is also reminding me too of a friend that was dealing with some OCD stuff and talking about how different it is from treating ADHD, where you often try and help the process along, whereas with OCD that just reinforces the process.
1000%. So that's why I love talking about this, because the supports out there for ADHD are sometimes almost the opposite of what you need for the OCD. So there's very much a concurrence, but also a discongruence between those two disorders. So I'm excited to explore why.
So as a comorbid condition, like I'm sure there's a lot of overlapping symptoms as well. If you feel this need to self-soothe, that's probably very distracting, and that's like an impulsive thing, and it definitely will be affecting like your emotional regulation and all that. I'm like, so is there ways to kind of tease out what's driving the bus in this situation?
Absolutely. It's tricky because you really do need an OCD expert to catch OCD most of the time, because those of us who are regularly trained therapists, in our graduate programs, there actually is not specific OCD training in most of them. And so we tend to misdiagnose as GAD. And when there's a concurrence of ADHD and OCD, like you said, there can be so many overlapping issues, but the most important one is attentional. So a person with OCD, because so much of our world is this mental noise, we can seem very distracted. We can seem very checked out. And that can be actually presumed to be part of, ADHD, when actually it's what we call executive function overload, which is in OCD where the prefrontal cortex is actually overactivated to the point where we can't actually do the parts of our life that are needed to do. We seem very zoned out. So while OCD is an overactivity in the frontal lobe, ADHD can sometimes be an underactivity in the frontal lobe. So the two sometimes seem to be like playing a tug of war in our brains.
One of the other things I was thinking could be a huge confounding factor here too is like the ADHD, like hyper focus on something. And that combined with this like need to self-soothe could be like a very negative reinforcing cycle.
Yes, 1000%. And there's a lot of concurrence, not just with ADHD, but also with ASD. And so a lot of times compulsions might be misinterpreted as stims. Obsessions can be misinterpreted as special interests. There's a lot of ways in which, all of these brain diversities can overlap in a way that can be very confusing, not only to the clinician, but to the person experiencing them. And I know this firsthand because I have both OCD and ADHD. And I feel oftentimes that I have been coping with my ADHD through utilizing the rituals of my OCD. And it made both of the brain differences harder to diagnose and just harder for me to even have self-awareness of.
Oh yeah, I can totally see that too, because I do a lot of like self-treatment of my ADHD with anxiety.
Yes.
Like while I was late to this particular meeting, that is something that doesn't happen to me very often because I have so much anxiety about being late that it solves for that. And that makes it harder to diagnose that, oh yeah, am I chronically late? No, but I would be.
Yes. I mean, that's a perfect example. If we just stay with the lateness. So my clients that have ADHD plus OCD, I can't really tell what the relationship is to lateness. Some of them actually show up compulsively early because of a fear of being late. But then some people with ADHD have a fear of being bored or fear of wasting time. And so they want to show up exactly on time. But then the anxiety comes up like, well, if I show up exactly on time, then I'm going to show up late. And so like the two are in battle. They're who's going to have more control, the ADHD or the OCD. And sometimes the person's values are getting lost in the process. So there's no consideration of like, what do I actually want or need? What works with my value system? It's more sort of obeying this fear-based structure in our brains.
I'm kind of thinking too here, just to make sure that listeners can kind of have a better feel of this. What are some of like the common traits we might see with OCD that might be used for this like first step of like, hey, I should go get this checked out? Because like the pop culture definition of OCD is ADHD has the same problem where like the pop culture is just so wrong. And then you're like, this is not what that actually is at all.
OCD, it's very difficult to capture it with, just in a short blurb because it has so many different ways that it can show up. One of the most common that we see is for someone to feel very afraid of losing control. So at its foundation, it's a control disorder, and also someone who cannot tolerate uncertainty. So if there is uncertainty about whether they're sick, uncertainty about whether they're loved, uncertainty in their job, that the inability to just be with that ick, as we call it, without doing things to self-soothe and to know for sure. That would be kind of the main issue that I would highlight around OCD is this feeling of like the world is dangerous, maybe I'm dangerous, something horrible could go wrong, and I have to be in control in order to be okay.
Yeah, that makes a lot of sense. And it does sound like this is something that's very much needs that like clinician involved with because, there's so many confounding factors here.
It is so, yes, 1000%. And there's also a strong concurrence with people who have both ADHD and OCD. There's a huge concurrence of eating disorders, as well as BFRBs, body-focused repetitive behaviors, which are things like skin picking, hair pulling, nail biting. There's also quite a bit of overlap between ADHD and OCD and hoarding disorder. There's many different clues that are laid down by this co-occurrence. And maybe even for clinicians who are listening to this or people, if you're not improving through talk therapy and you think you have generalized anxiety disorder, it's possible that maybe you are being underdiagnosed or misdiagnosed, and perhaps what you actually have is OCD. I get so many people in my office that have done talk therapy for 10 years, and then within 2 months of doing exposure response prevention, they are in a completely different space. So that's another clue, like you're not getting better with traditional approaches.
Yeah, that's one thing I've always tried to communicate is that if you are struggling and there doesn't seem to be a reason behind it, like, well, there is a reason. That's what you need to kind of be focusing on. It's like, okay, whatever I thought it was might not be the case.
Yes. Another way to, if you're a person with ADHD and you're listening to this and you're like, wait, could I have OCD? One other clue is for those of us who take stimulants, sometimes stimulants can actually activate compulsions and they can make us hyper-focus on our compulsions. It's not everybody that has this experience, but I'll say personally, stimulants, I'm so glad that they exist. They do actually really cause me to compulse and obsess, and I have to use them with some caution because of the way that my nervous system reacts.
I'm kind of curious too here. I'm thinking about these impulsive activities that a lot of us with ADHD have, and I'm sure there's people listening being like, oh, I feel like I have to do these things. Does this mean that, I'm also at risk or have OCD? Because I'm like sitting here playing with my fidget and I'm like, is this a compulsive behavior or is this just something that is, well within normal for ADHD?
Okay, that's a great question. So what defines a compulsion, especially when you're neurodiverse and you have a bunch of things that you feel like you need to do, what defines a compulsion is actually the ick that comes before it. So when I'm fidgeting with something for my ADHD, I'm not feeling any ick or anything. I'm not feeling anxious. I'm just feeling that I need that thing in order to focus. There's just pure joy when it comes to my fidgets. I have a very positive relationship with them. If I don't have one, it's okay. Like I don't, have any panic about that. With compulsions, it feels so much more rigid than that. Compulsions are like, I have to do it this way at this time with this thing, or something bad will happen, or this podcast will be a disaster. OCD is much darker than ADHD. I sort of describe my brain as like the ADHD part is like la la la, like happy go lucky. And then my OCD part is like everything is messed up. Like I get that sort of competing energies in my head. And I actually feel like my value system, my personality is a lot more like the ADHD. And the OCD is something maladaptive in my brain that is sort of interfering with me just like living my best life.
That makes a lot of sense because, yes, while I have all these things with my ADHD, it's like, oh, I want to go do that. And I'm, like there's like the tag I can't ignore or something. It's not a dark thing. It's just like, oh, I just can't ignore it. I need to take care of it.
Yes. So, and sensory issues, they're annoying. They can even be overwhelming. However, OCD, the ick is very strong. It's far more than an annoyance. Like it is this feeling of like something really problematic is happening and I have to stop it. That's how I would kind of understand OCD in general, is that it is propelling you out of anxiety and fear and catastrophization.
Yeah. And I think that's a good way for people to kind of think about it then, because then I don't want people to unduly be like, oh, I have to go check this out now.
Yeah.
Because half the time I like talk about comorbidities. I'm like, is that me too?
Yeah, that's normal. I mean, OCD is the fourth most common mental health disorder in the world. So I think above all else, it's just underdiagnosed and missed. And I think that while I don't want to plant any seeds that are undue in people's heads, even worrying if you have a disorder can be a part of OCD, where we're like compulsively Googling, like, do I have cancer or am I autistic? Even though, not that those two things are similar, but we are trying to know for sure a question that is like opening up in our heads and we literally can't put to bed. And so that's part of the compulsive cycle, which is different than impulsivity, which is sort of more like a one time, like I feel like I have to do this thing and it's fun. Compulsivity is incredibly repetitive. And it's quite often boring. Like we're doing the same thing over and over and over.
Yeah. And is there like kind of an aspect of like maybe not even like being mentally aware of that's what's going on?
Oh, yeah, definitely. I mean, so I have the same issue with my ADHD. I obviously don't, this is my brain, so I don't know what it's like not to have an ADHD brain. But with OCD, my onset was at 7. Many people's OCD onset is in like pre-adolescence. It's pretty uncommon to have late onset, like adult OCD. It does happen, but many of us have gotten to the point in our adulthoods where this feels like it's inherent to us. We're not quite sure who we are without the OCD. And so it can feel very natural to feel like a twinge in my shoulder and immediately Google it and make an appointment. Like that's just the way I've functioned. So sometimes you need to speak to an OCD clinician or somebody else with OCD to understand that those behaviors are maladaptive and they aren't serving us long term.
And I'm sure this is also plays in with things with like PTSD and that kind of thing where you have these, again, maladaptive behaviors where you're like, oh, this is my brain trying to protect me from this thing. And it's just, that's how my brain's working now.
Mm-hmm. Yes. Yes, absolutely. And, for what it's worth, some people's OCD, while it is very genetic, some people's OCD does get triggered by a trauma event. And then the OCD sort of builds itself around that trauma. That was my experience, that my OCD always molded around this core fear that was based on a trauma event.
I can see how also with this, I'm sure this is kind of more like there's like a spectrum of your symptoms. And so there are certainly people that will be like, yeah, I feel some of these things, but it's not affecting me in such a way that I can't function in life.
Yes. I would say that OCD, many people have mild OCD. It may or may not need treatment. The spectrum, though, goes all the way to what is actually called extreme OCD. And these cases almost always need a higher level of care. There can be psychosis at the top end of OCD. I myself have experienced that. There can be an extreme amount of avoidance. So that's usually the number one compulsion for extreme OCD, is basically shutting down our lives and making them smaller and smaller. So when people are experiencing agoraphobia, a fear of panic outside of the home or in different situations, they make their lives less challenging. They work to avoid anxiety, and that actually makes the OCD much more pronounced.
That's so opposite of how you treat ADHD. I can see how that'd be so hard.
So it is very complex. But I'll say, quite a few people that have those extreme levels of OCD also have ADHD. And, previously had their main challenges were around like attention, around being able to like access certain executive functions. But the OCD has slowly eroded any like functioning ability to the point where everything is about anxiety avoidance.
Well, anxiety can be a problem. It is also not, moderate doses should be kind of expected, like in life.
Yeah. And that's the treatment actually for OCD, is you normalize anxiety and you actually help the experiencer see that they can do hard things. They can face their anxiety. They can feel uncomfortable. And honestly, OCD is lying to us. Our OCD makes us think that we're far more weak than we actually are. Our OCD will make us feel as if we cannot not obey the OCD rules or the voice. And what we have to do is actually start breaking the OCD rules. And to do so, we need a coach or a therapist that understands that like facing your distress is going to be a huge part of recovery.
Yeah, I know when years ago I was dealing with a lot of perfectionism issues, and the thing that I did to start, I was just like, I'm going to start practicing doing things wrong.
Yes.
We had the plates in the cabinets that were light blue and dark blue. And I was like, they go in light blue and dark blue stacks. And that's how we do it. And then I was like, told Noah, like, hey, let's just start mixing them up. And boy, did that feel uncomfortable at first. But like now I don't even think about it now. And I'm just like, okay, this is actually super easy to put things away. And this is not an issue. And I can like try and apply those ideas to other places in my life where I'm like, it's okay that I had this error. I mean, and just that popped into my head that I had a thing on Blue Sky where I typed KNOW instead of just NO. So it's like no instead of no. And I'm like looking at it like later, I'm like, oh no, but that's okay. It's fine. This is fine.
That's amazing that you say that as an example, because that's actually an exposure that I assign to people, to purposefully misspell something in a social media post or in an email, to actually make a mistake intentionally in order to sort of retrain the brain that like the world doesn't stop. In fact, almost no one notices. And if someone notices, we aren't overwhelmed with embarrassment. So that's part of with perfectionism, is normalizing the error, because sometimes perfectionism in its extreme forms can lead to inaction.
Man, I don't even think the extreme forms lead to inaction. A lot of like, that was kind of like where I was like, I need to get over this, because I like this like revelation of like thinking about perfectionism being like, oh, if I judge my self-worth on what I produce and I'm a perfectionist, but I know nothing I produce can be perfect, then I will have no self-worth ever.
Yes.
That seems like a problem.
Yes. Yes. And OCD absolutely preys on self-worth. It says, I have intrusive voices that have been telling me since I was little that I'm stupid, that I'm incapable, that I'm unworthy. And there's been no amount of achievement that I've been able to have that has quieted those voices. And so the best thing that I could do is to just not interact with them, not give them weight, not act like I have to prove those voices wrong, because it's impossible. So I think that people with ADHD, because we get told a lot when we're children that we're wrong. Like, why don't you know how to do that? How could you forget this? Like, how could you lose that? Blah, blah, blah. All the things that we hear. I think it makes us especially susceptible to the negative, intrusive self-talk that OCD places in our brains. And it makes us feel like, oh, well, everyone says this to me. I must suck. And I, need to overcompensate for that in order to like make people please others and to feel like I'm okay.
Yeah, I can totally see that overcompensation piece and just if I make it so that I never make a mistake, then I will never be corrected. And
Yes.
I can see how quickly that can lead into all this like toxic behavior of maladaptive things where you're like, I'm just doing these things so that no one's going to ever complain.
And so people with OCD were famous for people pleasing and also conflict avoidance. And also, just like ADHD, rejection sensitivity is a really big thing. Because if you have this negative voice in your head telling you that you are worthless or whatever nonsense it's saying, you are going to be even more reactive to other people criticizing you or rejecting you.
Yeah, absolutely. Because I'm like hearing them like, oh yeah, that one. Mm-hmm, yep. Things to talk about with my therapist this week.
I tend to do that. My colleagues joke that I'm like Oprah with OCD diagnoses, that you have OCD and you have OCD, that I'm like bringing up a lot of it. But really, like you said, it's a continuum. And at the lower levels, it can definitely be a form of generalized anxiety disorder or just some OCD tendencies that, many of us have due to having this neurodiverse brain. So I think that there's a lot of food for thought when it comes to OCD treatment, but that everybody should look into exposure response prevention, which is basically just face your fears without doing your safety behaviors. That's the entire concept.
I was also like looking at some of the other therapy options that at the Kairos Wellness. And I was just curious, so is that just the primary one, or are there a lot of other things that you might be looking at as well?
There are a lot of different approaches. I would say ERP, exposure response prevention, is hands down the gold standard for OCD treatment. We also get people in our center that have generalized anxiety disorder. You don't have to treat that with ERP. And we sometimes get people that have gone through exposure response prevention, but have some trauma from that. So in those cases, we will approach with neurofeedback, with ACT, acceptance commitment therapy. We might bring in some DBT, some dialectical behavioral therapy in order to increase that distress tolerance in order to be able to do the ERP. There's a lot of different approaches to OCD work, but I just really want to emphasize that exposure response prevention is one of those very data-backed therapy approaches that I don't want it to be left on the table. One of the main issues is that not a lot of us are trained in exposure response prevention, and I think that's the number one reason why it's not utilized more.
Yeah, it all depends on like what people know they're going to do. One of the things I was also wondering about is a lot of us know about CBT, and I feel like what I know about CBT makes me wonder if that would be effective. Like I can see how DBT would be much more effective because that's more of like yes, what your experience is true, whereas CBT kind of does more questioning of if it is true.
Yeah, there's a type of OCD treatment called inference-based CBT, ICBT, which some people are really excited about as a new approach. And it does function along like questioning the OCD voice. I would say OCD therapists, the purist among us, will say that you can't think your way out of OCD. You can't think your way out of illogical thought spirals. If we could, we would have already. And so we instead have to choose to do things that create new neural pathways. So if I have a child in my therapy room that's afraid of the wind, we can talk about how the wind is safe, how that's a cognitive distortion, blah, blah, blah. Or we can go out into the wind and have them sit with their distress and realize that it's less frightening than they believe it to be.
Yeah, because it is built up in our mind, but it's hard to think out of what you've built up.
Yes. And those of us with OCD, we're great at creating anticipatory anxiety. we often overestimate how hard something will be for us. And once we actually do it, usually the feedback I get from my clients is, oh, that wasn't that bad. That's what it kind of all universally, that I managed to create something far more severe in my brain as I was imagining it.
That's true for everyone, too.
Yes.
Just like, we overthink situations. And when we get to a situation like, well, I get that was not quite what I imagined.
And I'll say this is one place that ADHD actually helps with OCD treatment, because we do have a little bit of, some of us have impulsivity, and we're not as risk averse as other brains tend to be. And that can actually really help, because we are more likely to just like hold our nose and dive in than, other types of brains. And OCD makes us incredibly risk averse. And so the ADHD can actually help combat that and get us to just make the leap into action.
Yeah, I could also see when I'm like stuck in my head because of my variable focus, I'll suddenly realize I'm not paying attention to that thing that I thought I was so important a minute ago. I can see how that having that impulsive behavior, just doing something, you're like, oh, that wasn't so bad because I forgot completely about it while I was doing this other thing.
I'm so glad you say that. Super relatable. People without ADHD, but who have OCD, they don't understand how we can just forget the worry. And that happens to me all the time. I will be obsessed with something, and if I don't do my compulsion, my brain will just like move on, which is, something that I'm grateful to my ADHD for, that I can pivot away from this stuckness that OCD wants me to be in.
Well, I was wondering if you just had any final thoughts you wanted to leave the audience with.
Okay, yes. Thank you so much for having me on. I appreciate people with ADHD listening about OCD. I just want to emphasize the fact that most people with ADHD have some co-occurring anxiety. As you said, William, the tendency to compensate for ADHD with anxiety is incredibly normal in our population. And what I would say is that OCD is like a tick above the rest. And so if you are feeling like the things that I'm saying are resonating with you, feel free to check out online. You can look at the Y-Box, which is the Yale Brown Obsessive Compulsive Scale. It's just a survey. It's completely free, available for public use. And just take a look if there's other things that maybe I didn't mention that really resonate with you. And feel free to send me a personal email. It's Natalia@KairosWellnessCollective.com. I compulsively answer my emails, partially because I know that most of us live in areas without OCD clinicians, and I can definitely guide you to any resources in your area. And I also strongly suggest that people check out the IOCDF, the International OCD Federation. We have conferences twice a year that are amazing. They're for lived experiencers plus clinicians, and some of us that are both. So there's definitely support out there, myself included. And, please don't just experience this alone. Know that there's quite a few of us and many people that are looking to connect and support and help.
And this also just triggered one more question that I was thinking about here. It was from my understanding too, it's easier to treat a much milder case of OCD. And if you're not treating it, it sounds like it gets worse. So this is something that if you kind of suspect, it is worth looking into early, right?
Absolutely. So OCD can snowball over time when left untreated, and talk therapy can actually sometimes exacerbate OCD symptoms. So if you're noticing kind of some mild occurrences of it, definitely hold some curiosity to it, because the toughest cases are the ones that have been entrenched over the course of many years, and it's more helpful to cut it off at the pass.
Okay, great. Well, thank you so much for coming on the show. I'm sure a lot of people are going to get a lot out of this episode.
Thank you so much for having me. I appreciate you.
Thanks again to Natalia for coming on the show, and thank you for sticking with us all the way to the end. Before you go, though, let's do a quick rundown of today's top tips. 1. It's important to remember that you need to approach OCD and ADHD treatments differently. Techniques beneficial for one may exacerbate the other. 2. try to distinguish between compulsions and simple fidgets or stimming. While symptoms can be similar, it's essential to understand the root causes that characterize compulsions. 3. Be proactive in seeking diagnosis and treatment if OCD symptoms start appearing. Early intervention can prevent the condition from worsening. Alright, that's it. Thanks for listening. I'd love to hear what you thought of this episode. Feel free to connect with me over at hackingYourADHD.com/contact. If you'd like links or to read this episode's transcript, you can go to the show notes page at hackingYourADHD.com/209. And just one more quick reminder about my AMA Live on January 31st at 10 a.m. Pacific on the Hacking Your ADHD YouTube channel. If you want to RSVP and send me a question early, just head on over to hackingYourADHD.com/AMA. If you like even more Hacking Your ADHD, be sure to sign up for my newsletter, Any and All Distractions, which comes out every other week. In it, I give my best distractions of the week, be they what I'm reading, what I'm playing, or what I'm watching. I also try to give a few bits of actionable advice each newsletter, although your mileage may vary there. If that sounds like something you're interested in, head on over to hackingYourADHD.com/newsletter to sign up. I also wanted to let you know about our Patreon that I've been reworking. You can easily find that at hackingYourADHD.com/Patreon. We're going with a pay-what-you-want model, meaning that all levels of Patreon will be receiving all the same stuff. You can pay $0 or $2 or $10, and it's all the same. The only real difference coming from the rules that are signed on the Hacking Your ADHD Discord. Which reminds me that I also wanted to announce that we're on Discord now, which you can get access through from the Patreon, which again is pay what you want. So if you want to come check out the Discord or check out the Patreon and get yourself some access, you can do that at hackingYourADHD.com/Patreon. And also don't forget to go and subscribe to our YouTube channel, which again you can find at youtube.com/@hackingYourADHD. And if you're still looking for ways to support the show, you can do so by telling someone about the show, especially if you think a particular episode would resonate with them. Just click the share button on your podcast player and send them it over. Today's episode was powered by Shimmer, the #1 ADHD coaching platform for teens and adults. Struggling with ADHD isn't a one-size-fits-all issue, and neither is the help you choose. Each coach at Shimmer uses science-backed methods and a personal touch to guide you through your ADHD management journey. Your expert coaches can help bridge the gap between your current challenges and your goals. Start your journey now at www.shimmer.care and use promo code HackingYourADHD for a 30% discount on your first month. Unlock your potential today. That was www.shimmer.care with code HackingYourADHD. And now for your moment of dad. I was thinking of cooking an alligator for dinner, but I realized I only have a crock pot.